The glomerular capillary, a vital component of the renal filtration system, plays a central role in the intricate process of kidney function. Comprising a complex network of endothelial cells, the glomerular capillary facilitates the selective filtration of blood, ensuring the retention of essential components while eliminating waste products from the body. At the core of the glomerular capillary lies the glomerular basement membrane, GBM, a robust structure composed of collagen, laminins, and glycoproteins. This thick, electron-dense membrane provides structural integrity and acts as a barrier that selectively filters substances based on size and charge. The GBM is characterized by a negative charge, essential for maintaining the proper functioning of the filtration process. Surrounding the glomerular capillaries, the mesangium provides essential structural support to the glomerulus, aiding in its stability and function. Additionally, podocytes, specialized epithelial cells, contribute to the filtration process with their foot processes and filtration slits, allowing for the selective permeability of substances. However, disruptions in the integrity of the glomerular basement membrane can have severe consequences. Damage to this crucial structure can result in the loss of its negative charge, leading to a condition known as nephrotic syndrome. In this syndrome, the glomerulus becomes permeable to proteins, causing marked proteinuria, excessive protein excretion, often exceeding 3.5 grams per day. The loss of proteins, including albumin, into the urine results in hypoalbuminemia, a condition characterized by decreased levels of albumin in the blood. This reduction in albumin leads to decreased oncotic pressure, triggering fluid shifts into the interstitium and causing generalized edema, a hallmark of nephrotic syndrome. Furthermore, the liver responds to hypoalbuminemia by synthesizing proteins, including lipoproteins, leading to hyperlipidemia in individuals with nephrotic syndrome. In addition to these complications, proteinuria in nephrotic syndrome can also lead to the loss of antithrombin 3, a natural anticoagulant, causing a hypercoagulable state. This hypercoagulability increases the risk of renal vein thrombosis, which manifests with symptoms such as flank pain and gross hematuria. Moreover, proteinuria results in the loss of gamma-globulins, predisposing individuals to hypogammaglobulinemia and an increased susceptibility to encapsulated bacterial infections. Minimal change disease, a specific form of nephrotic syndrome primarily affecting children, is characterized by subtle histological changes, including podocyte effacement and fusion. This condition is often triggered by factors like upper respiratory infections or allergies and typically responds to glucocorticoid therapy. Focal segmental glomerulosclerosis, FSGS, another cause of nephrotic syndrome, affects only specific glomeruli or segments, causing sclerosis and podocyte abnormalities. FSGS can arise due to various factors, such as viral infections, heroin abuse, or underlying systemic diseases like diabetes, hypertension, vasculitis, or sickle cell disease. Unfortunately, FSGS frequently progresses to end-stage kidney disease. Diabetic nephropathy, a complication of diabetes, is a leading cause of nephrotic syndrome. It initially thickens the glomerular basement membrane due to non-enzymatic glycosylation and progresses to nodular glomerulosclerosis, marked by Kimmel-Steele-Wilson nodules, causing significant renal damage. Membranous glomerulopathy, another cause of nephrotic syndrome, results from the deposition of immune complexes along the basement membrane. It can be primary or secondary to conditions such as solid tumors, viral infections, or lupus erythematosus. Treatment often involves corticosteroids to mitigate the immune response. Finally, renal amyloidosis, a systemic disorder involving the deposition of misfolded proteins, can lead to nephrotic syndrome. In its advanced stages, amyloid deposits obliterate glomerular capillaries, impairing renal function. Diagnosis involves Congo red staining, which renders amyloid deposits pink and exhibits characteristic apple-green birefringence under polarized light. In conclusion, the glomerular capillary and its associated structures are essential components of the renal filtration system. Disruptions in their integrity, whether due to genetic factors, infections, or systemic diseases, can lead to severe renal complications, including nephrotic syndrome. Understanding these intricate mechanisms is vital for diagnosing, treating, and managing various renal disorders, ultimately ensuring the optimal functioning of this vital organ system in the human body.